What's up, guys? So today is April 6th, 2025. And as you can see by this big bandage on my neck, I had a total thyroidectomy 3 days ago on Thursday, April 3. Um, so the reason I'm making this video is to kind of tell you guys how I'm feeling post thyroidectomy and also why I had the thyroidectomy. So where I had left off on the last video was that I was planning to have a hemithyroidectomy. I was planning to have half of my thyroid out um, for papillary thyroid cancer of the left lobe. Um, I was originally diagnosed with papillary thyroid cancer in January, big nodule about 6, 7 centimeters, and my surgeon had recommended a full thyroidectomy, but I had said I wanted a hemithyroidectomy. I only wanted half of it out because ideally I wouldn't want to be on this levothyroxine medication for the rest of my life. Um, but something else, which is interesting about the papillary thyroid cancer that I had, hopefully still don't have, is that um, I also had hyperthyroidism. Most people with papillary thyroid cancer have either, they're either euthyroid, there's nothing wrong with their thyroid hormone levels, or they're hypothyroid. They don't have enough thyroid hormone levels. For me, I had hyperthyroidism. Um, so right before the surgery, about a week before the surgery, they tested my thyroid hormone levels, and my T4 was 1.8, which is right on the threshold of hyper and normal. And then my TSH, thyroid stimulating hormone, which is the part of the brain that detects low thyroid hormone and you know, is increased, is secreted to secrete more thyroid hormone. My TSH, thyroid stimulating hormone, was less than 0.0001. So for some reason, my thyroid was making a bunch of thyroid hormone without my brain telling it to do so. So why was that? Well, right after I made my last video, one day after, and one day before my surgery, this lab came in, um, which was my thyroid stimulating immunoglobulin lab. It had taken a while for the results of this lab to come in because my hospital doesn't have that lab, so they sent it to another hospital. And anyways, my thyroid stimulating immunoglobulin was elevated. So what does that mean? TSI, thyroid stimulating immunoglobulin, is highly sensitive and highly specific for Graves' disease. In other words, it means that I definitely have Graves' disease. My immune system is making antibodies to my thyroid for some reason, which is activating my thyroid and making a bunch of thyroid hormone. So after I found that out, um, I had to really think about what I wanted to do because the plan just one day before the surgery was we're going to do a hemithyroidectomy, but if there's positive lymph nodes underneath the thyroid, then I gave the surgeon permission to take the whole thing out because I would need further therapy to make sure all of my thyroid, cancer in the lymph nodes is dead, which is radioactive iodine therapy. That was the plan. But then I was thinking, look, if I have Graves' disease too, why not just take the whole thing out? Um, so I really thought hard about it, and mostly I conversed with ChatGPT about it, and I put my whole situation into ChatGPT, and I said, "What would you do?" And obviously, ChatGPT isn't a human being, but it does a good job of breaking down scenarios and whatnot. And so what it came down to was there's 5 scenarios of whether or not I do total or hemithyroidectomy. Um, of those 5 scenarios, one of them is the total thyroidectomy scenario. That scenario is you do the total thyroidectomy, which is what I ended up doing, and then you take levothyroxine hormone for the rest of your life. Probably take calcium pills for some time as well. Um, but you'll be in a normal thyroid state eventually, and your lifespan won't be affected. Then there's four possible scenarios if you have a hemithyroidectomy with this papillary thyroid cancer and also underlying Graves' disease. Scenario number one, you take the only the left side of the thyroid out, the right side stays in, and the right side it acts normal, and you don't need levothyroxine, and you live a normal life. That's possible, not very likely. Scenario number two is because I have underlying Graves' disease, I have these immunoglobulins stimulating my thyroid and causing them to make excess thyroid hormone. I would probably be hypothyroid at first because most of the thyroid hormone was coming out of the left side. But eventually, the Graves' disease those antibodies would also affect the right side, and I would become hyperthyroid again. In other words, the thyroid just from that right side would make too much thyroid hormone, and that happens. You guys can find articles about it on PubMed. It's happened where people have had half of their thyroid out, and all of a sudden, they're just the remaining side of the thyroid makes them hyperthyroid again. That to me was the worst case scenario, worst possible option, because then I would either have to have another thyroidectomy, which going into residency, going into a high demanding schedule, going into an area without a lot of healthcare options, without maybe not the best doctors or maybe good doctors. I don't know yet. Um, I don't know, if that scenario arose, how conveniently I could have yet another thyroid surgery. And so if I didn't have, and so if I was to get hyperthyroidism in the future because of Graves' disease in that remaining right lobe, and I couldn't have a surgery, automatically I would have to be taking like a methimazole beta blocker. I would have to be taking these medications to lower my heart rate and act against the thyroid. And those medications, I mean, you talk about levothyroxine, like I didn't want to take levothyroxine because I didn't want to be dependent on a medication for the rest of my life. But compared to, levothyroxine, those medications are way worse. I mean, they have their own side effects. Um, and so to me, that's the worst case scenario. If I had to choose between that or taking levothyroxine, I'll just take levothyroxine. Um, because levothyroxine is just normal thyroid hormone, right? As so it doesn't have nearly as much as the same side effects as being on a beta blocker or methimazole. So that's number two. Number three, of the scenario where I had a hemithyroidectomy would have been that the cancer comes back because with that nodule being so big, there was a pretty significant chance, 20-40% is what I think I remember hearing, of the cancer coming back around, in the right lobe. And again, in that case, I would have had to had a thyroid surgery again. Whatever, I would have been okay with that. That was a risk I was willing to take. And then number four is I would have been hypothyroid and I would have had to take levothyroxine anyways. Um, but probably not as much as I'm taking right now after getting the whole thing out. So I thought about it and what it came down to is I could hope for the best case scenario of taking only half of it out and my right lobe functioning and making up for it. But with this underlying Graves' disease, it just didn't make sense, because there's a pretty high chance I was going to become hyperthyroid again. And even if I didn't become hyperthyroid again, I would have become subclinically hyperthyroid again, which is what I was before, where the T4 is high, but not above the threshold, and the TSH is really low. Because even if you're subclinically hyperthyroid, that's still bad for you. That still makes your heart rate higher than it should be. It has negative effects on your thinking, which is what was happening to me. I mean, my exercise tolerance, for the past few months has been absolutely terrible because my heart rate has been so much higher than it should be. And, forget about the exercise tolerance. It just, having that kind of heart rate is bad long term. It decreases your life expectancy. So for me, it was like, I don't want to become hyperthyroid again. I don't want to take levothyroxine, but if I have to choose between the two, let's just take the whole thing out and then I'll take the levothyroxine. It's okay. Um, And so I talked to my surgeon the day before. My surgeon, she saw those lab results, but she was off that day. And so we decided to have the conversation like a few hours before the surgery. And she said, look, we had already decided, we're going to do this conditional hemithyroidectomy, where if we saw those positive lymph nodes under the thyroid, then we would have done a total. And my recommendation from the beginning, this is the surgeon speaking, was to take the whole thing out, right? Because your nodule is so big, because there's a high chance of the thyroid cancer coming back in the future. Now with the underlying Graves' disease, and also with the knowledge that papillary thyroid cancer in Graves' disease has a worse prognosis and is more aggressive, my suggestion is 100% take the whole thing out. And so I was like, okay, great, I'm on the same page with you. I talked to my parents, same page. So we decided to do a total thyroidectomy. Um, so then now let's talk about the actual surgery. Um, so pre-op, um, I the day before the surgery, they have you take a shower with a special kind of soap, and then in the morning, you take that shower again, and then in pre-op, I take all my clothes off and I get into a gown. And I also rub myself with that, soap again, not soap. I don't know what, like chlorhexidine, antimicrobial. Um, so that happened. I got in the bed and they wheeled me off to the operating room. And in the operating room, as they were preparing to put me under, um, the I think one of the nurses was like, Tyler, if you weren't here today, what would you be doing? And I was like, probably studying. And then the the resident ENT doctor was like, why, dude, you're an M4. And I was like, when I become a resident like you, I don't want to worry about step three. So I'm trying to get some studying in for that. So I feel good about it. And then they were like, yeah, that makes sense. And the anesthesia resident was like, yeah, I still haven't taken that either. That makes sense. But also you should enjoy your fourth year. But anyway, so they're starting to put me under, and then the nurse is like, think about a happy place. And then they put that propofol into me, and the anesthesiologist put a mask on me. So this was just oxygen. Um, so that's the last thing I remember before waking up. And as far as who did the surgery, it was an endocrine surgeon, very great, amazing surgeon. Trust her a lot. And the ENT resident assisted, and then there was two anesthesia residents in there as well. Um, so next thing I know, I wake up in the PACU, and the nurse, I think they said my name. And immediately I was like, I have to pee. And I think they laughed or something, they giggled, I don't know, but they gave me um a urinal, like something to pee in. And then they closed the blinds around my bed. And I tried to pee because my I was in so much pain, I felt like my bladder was going to explode. But I put that urinal, um underneath me and tried to pee, but no pee was coming out. I couldn't control my pee. Nothing was coming out, even though I felt like my bladder was going to explode. So then, so then I stood up in front of the bed and I put that urinal underneath me and tried to pee that way. Maybe gravity will help, and nothing came out. And I guess the nurse saw my feet under the blinds, under the curtains, and so she was like, "What are you doing?" And had me lie back on the bed again. And I was like, "I really have to pee. I can't control myself, you know, and nothing's coming out." So then I started to um, like pull on myself. Um, And I made the comment, I was like, my bad, this is like indecent exposure. But I was in so much pain. And then they did an ultrasound on my bladder, and it was like super distended. And they were like, we're gonna put a catheter in you. I was like, yes, please do that. So they put a catheter in me. And they say a catheter hurts, and maybe it did. But for me, it was like a small sting. It was nothing compared to like feeling like my bladder was going to explode. So then they put a catheter in me, and immediately I could just hear like the urine flowing out of me. And it must have been like a minute of just urine flowing out of me. And I was talking to the nurse. I was like, "Yeah, let it all out. Let it all out. Don't take the catheter out until all the urine comes out." Um, and overall, it was like a whole liter, 975 milliliters that came out of my bladder. And a normal bladder, I think, is supposed to hold like, I don't know, 300 to 600 milliliters. So it was a bunch of urine in there, and was like yellow. And I think it's because during surgery, they gave me like a liter of lactated Ringer fluids, and they gave me a 500 milliliters of some normal saline fluid. So um, I think that whole situation could have been prevented if I had had a catheter. I don't fault my surgeon because it's different for everybody. And originally we had planned to do like a 2 to 3 hour surgery, right? To take out only the left side. And so in that case, my urinary distension would not have been as bad. But with having taken both sides out, um, and I was in there for like 5 hours. Yeah, I mean, I wish they had cathed me during the surgery. So, if you're gonna have this surgery in the future, just make sure you ask your surgeon, can you catheterize me? Because you're not gonna feel the catheter going into you during the surgery, okay? And it's probably better than feeling like your bladder's going to explode after surgery. And because of the anesthesia, you can't even control your own pee. Like I couldn't pee, in that bed. So That was for like that 5 minutes or so, that was pretty traumatic, but it got better. Um, Next thing I know, so I was like really after that, after the whole bladder thing was resolved, I was like really happy. Because, and I think that's because the oxycodone, I don't know. I was like, oh, I'm so happy that they took out this whole thyroid. Let's get this thing. And then I started talking to the like nurse next to me about some stuff. Like she said she's from Nashville, so we started talking about like country music and stuff. And I was like overly talkative, like, you know, uh, the drugs were having some kind of effect on me. And I also like said like God is good, like a bunch of times. And one of the nurses was like, yeah, yep, God is good, so I don't know. I think it must have been oxycodone, maybe it was something else, but I was a little bit out of it there. Um, and then the ENT resident came along and he said, yeah, you had a huge tumor and it took a while to take it out. And there was definitely some lymph node involvement too. Um, and I said, great. I mean, in that case, I'm glad that you took the whole thing out. And then the doctor, the endocrine surgeon came by and she said the same thing. She said, we took the whole thing out. There was probably some lymph node involvement too. I had asked her to take a picture of my thyroid after they take it out, and I guess they had asked the nurse to do it, but within all the everything else going on, they forgot to take a picture. But they did take the thyroid and then the lymph nodes, and then they took three tissues to pathology. So three tissues are pending in pathology right now, and I guess I'll find out if what pathology says about the type of cancer in those tissues. Um, so yeah, that's how I felt after surgery. And then I laid in the PACU for a little bit more. I forgot they were waiting for something in the PACU, but eventually my bed opened up in the recovery unit. Um, and I wasn't in any pain post-surgery because they kept putting, those opioids into me. But a few hours after, I started noticing some pain, mainly on like neck movement, especially neck extension. Um, and I also had like a little bump on the top of my head, and I think it's because my head was like lying in a weird position um, on the surgery bed. So, anyways, they take me out of the PACU, they wheel me into the recovery unit, and I'm supposed to stay there overnight. And I had a really good dinner there. Hospital breakfast, not a hospital dinner and hospital breakfast is way better than I mean, for the patients, it's way better than like actually going to the cafeteria. I mean, they had a lot of good stuff on there. I had like tilapia, mashed potatoes, moose cake. It was good stuff. I had a good dinner. My parents were there. We talked. I was feeling pretty good, like immediately after the surgery. They gave me Tums. So, yeah, something else. When they took out the left side of the thyroid, so you have four parathyroid glands, right? Um, and during thyroid surgery, there's a chance of those parathyroid glands getting injured or taken out. So when they took out the giant tumor on my left side, I guess they might there's a pretty high chance that they lost the two parathyroid glands on that side, and that they the surgeon accidentally took those out with the tumor, which is fine. Um, because after they took the thyroid out, they looked around kind of in the fat around where the thyroid was, and they couldn't find the parathyroid glands in there. So whatever it happens, but on the right side, those two parathyroid glands are still there. So eventually, my calcium will be normal. But for the time being, there's a chance that I have low calcium. So immediately after the surgery, I was taking Tums, 200 milligram calcium carbonate tablets every 8 hours, four tablets every 8 hours. And Tums are pretty good. They taste like bottle caps. If you've ever had, the candy bottle caps, that's pretty much what they taste like. So I didn't mind. And then my voice, the tumor was like wrapped around my laryngeal nerve, and she was able to scrape it off. So luckily she didn't cut my laryngeal nerve, but I guess originally, like right when I woke up, my voice was kind of froggy, is what she said. And I guess now it's back to normal, is what I've heard. Um, I'm not really sure. I guess we'll see once I hear this video what my voice is like, but I don't think it's that bad. I don't think it had a huge effect on my voice. So yeah, I lied in that hospital bed for, overnight, and um, I didn't get any sleep because the lights are coming in from the hallway, and they wake me up to give me the medications and stuff. And they started me on levothyroxine, 137 milligrams, which I'm supposed to take every morning, an hour before eating, without anything else. Because anything else, any other pills, any other food, except for water, interferes with absorption. So then I left the hospital the next morning because they rechecked my calcium the next morning. They did the Schwastic test on me to see if, I had any symptoms of low calcium, hypocalcemia, and I didn't. And they drew my labs, and my PTH was 21, which is normal, but on the lower end of normal, and my calcium was 9.1. So they just discharged me. I had a good breakfast. I had some pancakes and whatnot, and then they discharged me. Um, so really quick reflection on the whole like hospital surgery experience is I want to talk a little bit about the difference between sympathy and empathy. Um, as medical students, I think most of us are sympathetic. Most of us, well, I don't know about most of us, but at least a lot of us, well, yeah, I'll say most of us. Most of us are sympathetic, we're good people, right? But empathy is when you've actually like been there. And so you can actually reach inside of yourself and feel the same thing the other person feels. And so maybe, something good that came out of this is that I feel more empathetic towards my patients, both from like actually sleeping in the hospital and like understanding what it's like how much it sucks to like, you know, how hard it is to sleep in a hospital. Granted, I was in a room where I didn't even have like ICU like beepers going off. And also just the whole having cancer thing, everything that comes with that, all the anxiety, all the feelings, all the emotions. So, you know, this whole experience, I think, has made me a more empathetic doctor. So that's probably a good thing. Now, I'm not going to say I even remotely feel the same as somebody who had a worse kind of cancer than this. I mean, because there's people who've had a way worse than this, but just having this cancer light, hopefully, is was enough to make me empathetic. Um, because I've noticed like even when I'm reading like UWorld question stems about people who like get cancer and stuff, it's not the same anymore. It's not just like trying to solve a question. It's more like it's like I actually feel bad. I'm like, oh man, this guy had cancer. So I don't know. It's made me more empathetic. Anyways, so going back, to the where I was in the hospital. They discharged me with plans for a follow-up appointment to do radioactive iodine therapy. To do a type of therapy which will kill any remaining thyroid tissue, microscopic thyroid tissue left in there, which is important because the lymph nodes look like they had cancer in them. So it's important that we kill the remaining cancer tissue before it um, causes problems. The thing is, my understanding of radioactive iodine therapy was that it doesn't have any side effects besides only killing the thyroid tissue. Um, because it's iodine and only the thyroid takes up iodine. But because it's radioactive, it seems to have some other side effects, like it seems to decrease fertility in males for like a year. So, anyways, I'm going to talk about this stuff with a nuclear medicine doctor in a few weeks um, before having that radioactive iodine therapy. That's the next thing. The other thing is because I've had Graves' disease, I don't know if my eyeballs are bulging or not, but Graves' disease can cause your eyeballs to bulge. Um, so I'm going to have an ophthalmology appointment too, sooner or later, to see if Graves' disease has had any effect on me. But the good thing is, if it has had any effect on me, it doesn't have any effect on me anymore because I got rid of the thyroid, and slowly but surely those immunoglobulins will go down as well because there's no antigen anymore. So that's where I go from there. How have I been feeling? Friday, Saturday, and today is Sunday. I got home on Friday. Um, for pain, nothing bad, just on neck movement. I've had some pain. I was instructed to take Tylenol every 6 hours. Instead, I've been taking it like once or twice a day, 500 milligram tablet. not even because of the pain, just because I think it might help with the swelling a little bit. Um, my pain is really only there when I like make really big movements with my neck, but otherwise there's no big pain. Um, Tums, yeah, calcium. I was instructed to take 8 tablets every 4 tablets every 8 hours. I've been taking like three tablets twice a day because I haven't had any symptoms of hypocalcemia, of low calcium, and I've also been drinking milk and drinking yogurt and stuff as well. So um, feeling good on that part. Before the surgery, I was slightly hyperthyroid. Now I think I'm kind of a little bit back to normal because I don't feel like my heart rate is as high as it used to be. Um, and my blood pressure is looking good. Like so immediately after the surgery, my blood pressure was high. It was like 140 over 80. So it was a little bit high, and I think maybe it was because of the fluids, even though I heard that fluids don't do that. So maybe it was because of something else. You know, I told the nurse, I was like, is it the fluids that cause my blood pressure to go up? And she was like, fluids don't do that. So maybe it was stress or something. I don't know. But blood pressure has come back to normal. Now it's like 115 over 80. So that's good. And that's even better than before because before the surgery, it was like 125 over 80 or something. And my pulse is like between 70 and 80. Before the surgery, it was my resting pulse was like 85, which is not healthy for a young, 27-year-old guy like me who, um, gets some exercise. Um, in terms of exercise tolerance, I was instructed not to like do any heavy exercise for a few days after surgery. So I've mostly just been sitting at home. And I think I've gained some weight. I've gained like 5 pounds. And I've looked at myself in the mirror and it's not like I've gained fat or anything. I think I've gained some muscle, to be honest with you guys. Um, so I don't really mind the weight gain so far. And I don't know if I'm hypothyroid or hyperthyroid yet, but I am taking that thyroid hormone every morning. And in a few weeks, hopefully not too long from now, I'll follow up with my surgeon. We'll see how my thyroid is doing. I mean, how my thyroid hormone levels are doing. Um, Today I did kind of walk outside a little bit and I ran for like 3 or 4 minutes and I got winded pretty fast. So I don't know why, but I still feel like my exercise tolerance is slightly better than before the surgery, because my heart rate wasn't as bad. It was just I got winded, which might be because I just haven't exercised in like a whole week. So I'm gonna keep exercising like every other day this week and seeing if my tolerance gets a little bit better. Um, yeah. So yeah, overall, that's how I feel 3 days post thyroidectomy. The scar looks fine as well. They put bupivacaine into it, so it's been numb for a few days. Now I'm starting to feel it a little bit more. It's a little bit itchy, but it's getting better. Um, so yeah, right now, no regrets, no regrets. Um, because I think I dodged a bullet with possibly having Graves' disease and possibly the cancer coming back. So feeling good right now. Um, Hopefully I can do that radioactive iodine therapy sooner rather than later so I can get it done before graduating medical school, but it doesn't seem like it. I think there's like a big wait time, like at least like I heard like 6 to 8 weeks before starting radioactive iodine therapy after surgery. So we'll see what happens with that, and we'll see about the side effects too. I'll make a few videos about that once I go down that road. That's where I'm at with the thyroid cancer story. Um, and I have my medications with me. I'll show you my thyroid pills. These are my thyroid pills. They didn't give me too much. I need to get a refill pretty soon. 137 milligrams. Really tiny, small pill. Really small. Easy to swallow. Um, so no problem taking these. I just hope that, society will be stable for the rest of my life so I can get this medication. Um, yeah. In terms of my medical school life, I'm starting a 2 week GI rotation tomorrow. So um, hopefully I can impress on that rotation. Um, because if down the road in medical school, in residency, I want to do a GI, fellowship. This is my chance, to have some sort of influence, some sort of impression. So yeah, that's where I'm at. Um, so yeah, good luck to you guys too with whatever you're doing. If you have thyroid cancer, you can ask me any questions. You know, um, everyone's gonna be fine. We're all gonna be fine, God willing, inshallah. So yeah, all right, thanks. See you guys.